Hello everyone, this is Syed Sagheer Ahmed. In this video, Antianginal Drugs Part 2, I am covering classification of antianginal drugs and mechanism of action of different class of antianginal drugs. This video is the continuation of my previous video, that is Antianginal Drugs Part 1. So before watching this video, please do watch my previous video. So let's get started. Classification of anti-anginal drugs. Different class of drugs are used to treat angina pectoris. Let us see one by one. The first category of drug used in the treatment of angina pectoris are nitrates. In that, short acting example is glyceryl trinitrate, long acting example isosorbate dinitrate and isosorbate mononitrate. Second category of drug, beta blockers, example propranolol and metoprolol. Third category, calcium channel blockers, example verapamil, diltiazem and nifedipine. Fourth category, potassium channel openers, example nicorandil. And fifth category, other antianginal drugs, example dipyridamole, ranolazine, etc. The drug of choice for the treatment of angina pectoris is organic nitrates. Organic nitrates are the vasodilators. It relaxes vascular smooth muscles. Organic nitrates increases oxygen supply to the heart by dilating coronary arteries and decreases oxygen demand by the heart by reducing preload and afterload. That really helps to manage anginal attacks. We will see the mechanism of action of organic nitrates. Organic nitrates undergo enzymatic denitration in the smooth muscle cell and releases reactive free radical nitric oxide that activates cytosolic guanylyl cyclase. Activation of guanylyl cyclase increases the concentration of cyclic GMP in the smooth muscle. That leads to dephosphorylation of myosin light chain kinase. Now, dephosphorylation is nothing but removal of phosphate group, usually during contraction of smooth muscle. Myosin light chain kinase is getting phosphorylated. I mean, phosphate group is added to myosin light chain kinase. Phosphorylation of myosin light chain kinase resulted in activation of myosin. Then myosin interact with actin. Actin and myosin are the contractile proteins that helps in the contraction of smooth muscles. Increase in the interaction of actin and myosin resulted in contraction of smooth muscles. Here, due to dephosphorylation of myosin light chain kinase, activation of myosin is affected. Due to this, there is no interaction between myosin and actin. Finally, there is a decrease contraction of smooth muscles. Along with this mechanism, even increase cyclic GMP may decreases entry of calcium into the smooth muscles. That leads to relaxation of smooth muscles. As we know very well, calcium ions are the excitatory ions. Once calcium enters into the smooth muscles, it causes contraction of smooth muscle. Here, because of organic nitrates, the influx of calcium is reduced. Due to this, the smooth muscles are getting relaxed. Overall, with these drugs, angina pectoris can be treated. Beta adrenergic blockers are usually used in the treatment of stable angina. In case of stable angina, Exercise, physical activity and emotions increases sympathetic activity that leads to increased heart rate, blood pressure and force of contraction of heart, resulted in increased workload on the heart, and finally it increases oxygen consumption of the heart. Beta adrenergic blockers such as propranolol, metoprolol, etc. bind to beta 1 receptor in the heart and block its action. This resulted in decreased heart rate, decreased force of contraction of heart, decreased workload on heart, and finally decreases oxygen consumption of heart. The category of beta adrenergic blockers, that is beta blockers with intrinsic sympathomimetic activity, should not be used to treat angina because it worsens angina. The category of beta blockers, that is beta blockers without intrinsic sympathomimetic activity, should be used because it decreases death rate of myocardial infarction patients. Another category of drug used in the treatment of angina is calcium channel blockers such as verapamil, diltiazem and nifedipine. Calcium channel blockers block L-type calcium channels that decreases calcium entry and calcium current into cardiac and vascular smooth muscles, resulted in decreased contractility and excitation in cardiac and vascular smooth muscles. This decreases oxygen demand by the heart and decreases workload on the heart, and finally angina can be treated. Potassium channel openers like nicorandil is also used in the treatment of angina pectoris. Nicorandil opens ATP sensitive potassium channels in the vascular smooth muscle that causes efflux or outflow of potassium from the smooth muscles, leads to hyperpolarization, that is relaxation of vascular smooth muscle, that leads to venodilation. Here the veins that brings the blood towards the heart, that is pulmonary veins and superior and inferior vena cava, are getting relaxed. So heart receives blood with less pressure. In this way preload decreases. Similarly, it causes arterial dilation. Here the arteries that carries the blood away from the heart, that is aorta and pulmonary artery, is getting relaxed. So heart does not need to push the blood into aorta and pulmonary artery with very high pressure. In this way afterload is decreased. Other than this, nicorandil also releases free radical nitric oxide that increases cyclic GMP and decreases the contraction of smooth muscles. This way workload on the heart is reduced, oxygen demand by the heart is decreased, and hence angina can be managed.